Hi, Premier. So I hear you saying here that there's this incredible partisan divide and the Liberals want to put the wealthy and well-connected at the top of their list, but you're talking about healthcare today, a topic in which all three parties cooperated in the legislature over the last 6 to 8 months, and a file in which the opposition critics of both parties worked with your health minister. It's pretty much the least partisan issue going on right now. So I'm struck by the disconnect in your message of somehow this is an incredible partisan divide on healthcare when I haven't seen the evidence of that. Can you explain if you're embellishing this for your purposes on the election campaign, or what is the argument you're making here?
Well, thanks for the question, Rob. And healthcare is not just dealing with COVID-19. Healthcare is dealing with wait times, which were at record highs when we came to government. Healthcare is making sure that we have the diagnostic equipment that citizens need so they can have early diagnosis and rapid treatment, whether it be for knees and hips and other ailments that can be resolved through surgeries that we are accelerating, or whether it be connecting patients to doctors. These were issues that the BC Liberals ignored for a decade and a half and that we've been working on for the past 3 years. I understand Mr. Wilkinson today was talking about the need for a second hospital in Surrey. Well, here's the facts on a second hospital in Surrey. Andrew Wilkinson, as a cabinet minister, sold the land that a previous government had purchased to build a second hospital. So we have bought new land, assembled an opportunity to build a second hospital. We approved a concept plan. We are now finalizing a business plan, and there's money in the budget. That's a significant divide between what we will do over the next 4 years and what the Liberals will do. I absolutely agree with the premise of your question that on COVID-19, there has been extraordinary cooperation between my health minister, Adrian Dix, and the opposition parties. But when we talk about health care, it's about the delivery of services for people outside of the COVID realm, and that's where the Liberals have fallen down, and that's where we want to make sure that people understand that our focus is on making sure they're connected to a doctor. We have primary care networks that we've developed in every corner of the province. Nurse practitioners, therapists, whether they be physiotherapists, whether they be social workers, RNs, doctors, connecting people to the healthcare system. That was a failure by the BC Liberals. We're resolving that issue.
Rob, do you have a follow-up?
Yes, please. And could I just get your reaction, I guess, as well, to how do you feel this message has gone over in the last day on the need for an early election? It's a very contentious issue. A lot of voters are debating it, whether you've made the right call here. How do you feel about what you're seeing and reading and hearing from voters so far?
Well, as you know, Rob, I struggled with this decision. I've been pretty clear on that. It did not come easily, but I know based on the evidence that's before me that we have not just a 12-month challenge ahead of us, but a multi-year challenge. And if we were going to continue to have the type of hectoring that will be involved over the next couple of weeks as part of an election campaign for 12 months, we won't be focusing on the things that matter to British Columbians. It's time to put the politics behind us. An election will do that. This is about making sure that people have a say. It's never a bad time to ask British Columbians what they want to do, where they want to go, and who they want to lead them, and that's why I called the election.
Our next question is from Marcella Bernardo.
Well, thank you for taking my question. Wanting to talk to you about what you seem to know that you're not sharing with British Columbians, in the sense that many people that I've talked to are worried that this election is happening because maybe there's something that the government and Dr. Henry is not sharing with people. What assurances can you offer to people who are preparing to vote in this election now that there isn't some secret information out there that you're not sharing because this pandemic is going to get a lot worse before it gets better?
Well, we're not hiding anything. I think the success we've had in British Columbia is the transparent approach that public health officials led by Dr. Henry and Minister Dix have had. Daily briefings on the state of play in British Columbia have been the norm. Unlike other jurisdictions, we got out early and often, talking about the issues that mattered to people, letting them know what the state of play was. I've been pretty clear as well. We are in a pandemic, not just for another couple of weeks, not just till Christmas time, but for at least the next year. And that's why I think it's time we put the politics behind us, have an election, and let people decide where they want to go and who they want to lead them.
Marcella, do you have a follow-up?
Having said that, we've heard from Dr. Henry this morning that a second wave is possible. How concerned are you that we're going to have massive super spreader outbreaks and that you may have to postpone this election, or possibly it wasn't a good idea to send everybody back to the polls so soon?
Well, I listened to Dr. Henry and Mr. Bowinn at Elections BC this morning. I heard them say that an election in British Columbia will be safe, and it's going to be unlike any we've ever had before. I realize and recognize that people are anxious. I know that. I understand that. My neighbors feel the same way. But I strongly believe that we need to put the politics behind us. We have a big task together as a province, not political parties, but as a province. And we need to be sure that the public is with us, and the best way forward is a stable government. I've been working with premiers and the federal government for the past 7 months. We're comparing notes, we're doing best practices, and time after time after time, my colleagues across the country have looked to British Columbia for leadership. I believe there's been an election in New Brunswick, there will be an election in Saskatchewan. I am absolutely confident that the election process can be safe, but I also know that we have enormous economic and health challenges ahead of us. I've been very clear about that. I'm being straightforward with British Columbians when I say that today. Let's get this figured out. Let's pick a government that will take us through the next 4 years.
Our next question is from Richard Zisman.
Horgan, whatever I call you now, NDP Leader Horgan. Are you willing to do 3 debates against Andrew Wilkinson and Sonia Furstenau?
That's not my lane. There are people that work on that all the time. The networks are involved in that. I'll leave that to others to decide. I'm happy to be available to talk to British Columbians in any format that we can put together that keeps them safe and allows us to have a full and complete airing of the issues, and people will be able to decide what they want and where they want to go, who they want to get us there.
Do you have a follow-up, Richard?
It could be your lane, though. Like, are you not willing to take on Andrew Wilkinson 3 different times in front of people? Like, is there
not at all
that you don't want?
No. I'm ready to do whatever it takes to get the message out to British Columbians, but I do not organize airtime. That's up to the networks. You know that. They'll figure it out, and whatever works for all of the parties and all of the people that participate, I'm ready to go.
Next question is from Tanya Fletcher.
Hi there, thank you. Can you describe how this campaign will look different? Obviously, it's unprecedented, you said that. Can you speak logistically how your specific campaign will look different during a pandemic, and how your strategy will be different from years past because of it?
Well, we're going to be working on it day by day. We've looked at other jurisdictions that have held elections. I think the other parties will do that as well. We're looking at best practices. We want to make sure that we're engaging with people, but we want to do it in a way that keeps them safe. And that's going to mean a lot of time on the telephone, a lot of time in small group meetings that are complying with public health orders. What I do know with certainty is that our campaign, and I assume other campaigns, will be focused on making sure that we're staying in align with the public health orders that Dr. Henry has in place. Like any other activity in our community, we believe that we can continue to operate and engage with people and discuss ideas and talk about the differences between the various visions for British Columbia that are on the table right now. I think we can do that safely, and we'll be managing that in the weeks ahead as best as we can.
Tanya, do you have a follow-up?
Yes, please, thanks. You've talked yesterday and today about how tough this decision was for you, how you've struggled mightily. When did you make that decision? At what point, how recently did you finally make that final call?
Well, it started to crystallize for me during the summer when we were doing our virtual legislation, and there were significant challenges with some of the legislation that we were bringing forward that I firmly believe were in the best interest of British Columbians. We had challenges, and a couple of bills were not able to proceed, and there were other issues on the floor of the legislature. I also participated in question period, and I appreciate I've been a member of the opposition for a long period of time, and there's a role, an appropriate role for the opposition to hold governments accountable. But the level of contempt, the level of acrimony between the parties struck me as at some point will no longer be sufficient to make sure we were all focused on the people of British Columbia. I consulted my colleagues. 7 of them had advised me they were not seeking re-election. I believe there's an equal number or more of BC Liberals that aren't seeking re-election. Dr. Weaver, who I worked so well with as leader of the Green Party, is going back to teach at UVic. So it seemed to me that the time to renew our legislature was now. 17 or more members of the legislature, 15 or more, I should say, members of the legislature not focused on their constituents as much as they've all worked very hard over the years, means that there are gaps in the representation of our province. And the time to fix that is now at the front end of the pandemic, not in the middle of it. The prospect of us coming to budget time in February and having a confidence vote and having to be forced into an election in February and March was something that I didn't believe was in the best interest of British Columbians. I felt that now was the time to do this. 32 days is ample opportunity for people to take a look at the offerings on the table from the various political parties and make a choice that's in the best interest for their family, their community, and the province.
Our next question is from Bob Mackin.
Bob Mackin, the Breaker.News. Good morning. If any member of the NDP campaign team, if a candidate, a worker, a volunteer, a contractor tests positive for COVID, will the party tell the public? And if any member of the NDP campaign, whether it's you, another candidate, worker, volunteer, is hospitalized, will you suspend the campaign?
Well, we'll conduct our campaign, as I said, following public health guidelines. And that's the commitment we've made to British Columbians, and I'm going to maintain that from now until Election Day.
You didn't give me a yes or no there.
I can't predict the health outcomes for people on my campaign or people across British Columbia. I know that we have COVID in our communities, and we have to take steps of physical distancing, which we're doing today at this press conference. We need to wear masks if we're too close to one another. We need to use the hand hygiene that Dr. Henry talks about so ably, and we need to make sure that we take steps as individuals to not just protect ourselves, but those around us. That's my commitment to British Columbians, and I'll stay fast to that.
Now, my follow-up is that this campaign, like all campaigns, is not being held in a bubble. We're out here in public today. We are physically distancing. There's also members of the public here. Back earlier this year, when the virus was less of a threat to British Columbians, the NHL wanted to come to Vancouver in a very strict, structured way and play at one venue, be behind security, no fans, behind fences, have hotels. And Dr. Bonnie Henry and your office were involved with the talks with the NHL, who eventually did go elsewhere to Edmonton because BC was being that strict. Now, you told us yesterday that you did not consult with Dr. Henry, and she said that you did not consult with her. Why were you so active in due diligence for the National Hockey League, but not for the NDP? Does the NDP have a different set of rules than the NHL?
Not at all. Look, I talk to Dr. Henry regularly. I am participating in briefings with her all the time. I look at the modeling as the public does. Dr. Henry gave me all of the information I needed to make the decision that was mine alone. Dr. Henry has worked with Elections BC, worked with the federal government, worked with other public health officials across the country to ensure that wherever elections may take place, whether municipally, provincially, or federally, that public health guidelines are in place. That is her job. She made it clear to me that an election could be conducted safely. The decision to call an election was mine and mine alone, and I take full responsibility for that.
Our next question is from Brenna Owen.
Hi there. Sorry, my mask. I know it's hard to speak, but so Sonia Furstenau has.
Oh, sorry.
Hi. Sonia Furstenau spoke about the kind of unprecedented level of cooperation that was happening in the legislature over the spring session and the emergency session. But you've mentioned uncertainty. You spoke a little bit about it, but a little bit more today. She also said she's concerned about what won't get done because of the election and the things that will be pushed off track. So what are your concerns? What are you going to be looking to get off the ground as soon as another government is formed?
Well, we have a government in British Columbia right now. We are not without a government. We are conducting an election. Carol James, the Deputy Premier and Minister of Finance, is the stay-behind minister. She's not seeking re-election. She's working with the professional public service to ensure that all of the policies and programs of the government that have been approved by the legislature or approved by the Treasury Board of Cabinet are implemented. So the government is functioning. There's not a day that will go by that services won't be provided to people or there won't be oversight at the cabinet level from Carol James, someone who I have the highest regard for, more confidence in her than any other British Columbian that I've come upon. So I am very confident that the government of British Columbia is able to continue to function and provide services for people. With respect to Ms. Furstenau's assertion that we were getting along and work was being done, we did do an incredible amount together over the past 3 years. But this past summer, that was not the case. There was suggestions that support would not be forthcoming for the coming budget if certain things didn't happen. I don't believe that's the type of attitude that we need when we're going through a pandemic. I believe we need to have a stable government that will continue to collaborate, absolutely. I've spent the past 3 years working with business, with labor, with not-for-profits, Indigenous peoples, environmental organizations. The whole continuum of British Columbians have been on my speed dial. I've been engaging with people since the day I came into office, and I'm going to continue doing that in the best interest of all British Columbians.
Next question is from Sheila Scott.
Hi, just more on the Stikine situation up in northern BC. A lot of controversy around how this has happened. I know you were asked about it yesterday, but were the equity rules from your own party broken in the way that this has unfolded?
That's not my understanding. I know that the Stikine constituency conducted an exhaustive candidate search. They talked to a dozen or more people who would have complied with our equity mandate, and none of them were prepared to seek election. I also know that on either side of the Stikine constituency in the Chaco Lakes, there is an Indigenous woman running for the NDP, and I know on the other side of Stikine, in the constituency of Skeena, an Indigenous woman is running for the NDP. On one side of the Chaco constituency, the mayor of Mackenzie woman is running for the NDP, and on the coast, my friend and Bowinn Ma colleague Jen Rice is seeking re-election in Prince Rupert. So we have complied with the equity mandate because we believe it's in the interest of all British Columbians to ensure that the people that are representing us reflect the values and the faces, quite frankly, of the people that they serve. I'm very proud of the mandate, and I'm confident that it's been applied in this case.
We have time for one more question. That'll be from Brent Richter. Go ahead, Brent.
Hi there. I'm wondering how much of an actual platform can we expect to see over the coming weeks in terms of policy promises, and how can voters be asked to make decisions about policy promises when, for 4 years, when we know so little about what's going to happen in a week or a month?
Well, that's a very good question, and a significantly challenging one for all of us as citizens, not just as elected representatives. Obviously, people are elected to use their best judgment in circumstances as they arise, and none of us anticipated a global pandemic. I'm absolutely certain that not a British Columbian saw this coming. Now, having said that, we have to ensure that we are prepared for every eventuality, and government, I believe, working with public health officials and the people of BC, have done a pretty good job. British Columbians understand where we're at. British Columbians want to know what are the values and ideas that the leaders of the various political parties are going to put forward, and then they can make a decision on where they want to go and put their vote for a government that will be in place for the next 4 years. Today, Bowinn and I are talking about urgent primary care centres. This is an innovation that is absolutely timely for a pandemic because it's kept people out of our acute care system and given them an opportunity to connect with a healthcare provider that they need in their community. It's made a big difference here in North Van. It's made a big difference in my community of Langford, as well as in Quesnel, Prince George, Kamloops, Castlegar, Vernon, and on they go. Surrey, Vancouver, a host of communities have urgent primary care centres, and our commitment today is 10 more of them next year.